All right. Well, it is 6 o'clock on August 3rd. I'd like to welcome everybody to this special board meeting for the Boise School District. I call it to order. Clerk, can you do the roll for us since we are having some Zoom members tonight?
Trustee Greeley. Here. Trustee Gregory.
Here.
Trustee Hawes.
Here.
Trustee Langley. Trustee Langley.
She's here. I see her here.
I can see her too. Trustee
Liz?
Oppenheimer.
Here.
Trustee Wagers.
Here. And we'll go back to Trustee Langley.
And Trustee Esty is not present.
Okay. Trustee Esty is not available tonight. I'd like to remind everybody and remind the board as well that we conduct all our meetings following the district's core values. So we follow with respect, dignity, honesty, responsibility, and teamwork. And I'd like to thank you all for attending tonight. Appreciate you all being here. As we go through this very short meeting. Well, I don't know if it'll be short or not, but short agenda, I should say. That's so we'll go ahead and move on to the one item that's on the agenda, and that is we're going to review the pandemic plan for the 2021-2022 school year. And I believe Deputy Superintendent Roberts will be doing a presentation.
Good evening, President Wagers, trustees. So we were here just a few weeks ago and we presented our opening plan and the board voted on that plan. And some conditions have changed within our community. So I just want to remind the board that on July 12th, the plan update said in determining which mitigation strategies will be implemented during community transmission, our district will consider guidance provided by national and local health professionals and current district data. So I'm here this evening to talk to you about that guidance and the current district data. Would also like to remind you, we're on the first, thanks, Kevin. You're going to switch slides, thank you. We have been very careful over the last 17, 18 months to stick with our interests as we've tried to make decisions. So we had interest in offering a high quality in-person and comprehensive educational experience 5 days a week, respect the national and local guidance and follow practices to ensure the safety of students and staff, be creative, flexible, and sustainable in our instruction, school operations, and problem solving. So whenever we make a decision, we try and follow very specifically those interests. The average weekly case rates for 100,000 for Ada County, currently for this week, came in at 140.58 per 100,000. Unfortunately, putting us in the red high transmission category. This is up from 88.67 per 100,000 the week of July 26th, and up even from 73.51 per 100,000 the week of July 12th. The total number of cases currently is 677. This is in Ada County again, up from 427 on the 26th of July and 256 on the 12th of July. Positivity rates for ages 5 through 12 and 12 through 18 have increased significantly in our community. Dr. Peterman from Primary Health Group today was telling us that the 5 to 12-year-olds have doubled and the 12 to 18-year-olds have tripled. Factors we are and we will continue to watch closely for. Number of COVID-19 cases, of course, in the county, in our schools, within our staff. Community transmission, which is that red category currently. Spread of COVID-19 in our schools. Number of students and staff who are quarantined. This is a very, very important factor for us. So if you remember, last November, we made the decision to go remote for the time between Thanksgiving and Christmas because our operations were in such dire need because we had 1,800 out on quarantine between students and staff. And with 1,800, it was to the point where we were not able to offer equitable education in person and remote. So we went remote. So quarantining is really important to us. What's different this time around? CDH has new guidance that indicates if a student is wearing a mask and is exposed to another student or person who was wearing a mask, but then is tested positive for COVID and both of them were wearing a mask, the exposed student will not have to quarantine as long as they don't have symptoms. That's new guidance for us, and that will make a huge difference in us staying in person school. In addition, if an adult has been vaccinated, they will not have to also quarantine if they're exposed to another person in the school setting that is COVID positive. So our hope is that with mask usage, which we'll talk about in just a moment, and being vaccinated, we will have a highly positive impact on keeping students and staff in school and in-person learning. Support from our local health professionals. We continue to consult with Central District Health. We've talked to Dr. Brownwell from St. Luke's and Dr. Nasser from St. Al's twice within the last 5 days. And then today we also spoke with Dr. Peterman from Primary Health. All three doctors, very unfortunately, indicated that they believe we are entering the fourth wave of the pandemic. The availability of the vaccine for ages 5 to 11 is something else we will closely monitor as we determine, if there's a time when we can go to masks optional or encouraged. So what does this mean? And again, I think we were all really excited at the prospect of being able to remove our masks earlier this year. But based on all of this information and what we know about face coverings helping us to stay in school in person, the administration recommends requiring face coverings indoors for all students, staff, and visitors, regardless of vaccination status. Face coverings will only be required outside for large gatherings. We will continue to implement our other mitigation measures approved on July 12th. Social distancing is to the greatest extent we can, sanitizing. We will monitor district and local data carefully and regularly, and we will seek guidance from our health professionals. And with that, I will stand for questions.
Trustee Greeley.
Thank you, Deputy Superintendent Roberts. Can you define for me in your recommendation what is meant by large gatherings outside? So for example, there's a recess, a large gathering.
Recess would not be considered a large gathering. So if they're out playing, moving around, it would be if you were going to take maybe a group out to do like a big class picture. Like I know sometimes like the 6th grade will go out to do a big class picture. If there was some setting that you were going to go out and for some reason they all had to be sitting close to each other, then we would ask you to wear your masks. If they can be spread out and they're outdoors, they would not have to wear their masks.
Any other clarifications?
Langley.
Sorry, Trustee Langley.
Can you remind me of how many times or how often we meet with our medical professionals?
President Wagers, Trustee Langley, over the summer, we were able to meet less often than what we did last school year. So we met about every 3 to 4 weeks. Like I said, recently, we've met twice within the last 5 days, about 3 times within the last 3 weeks. We've just decided today again that we will resume our every other week. We will meet with Dr. Nasser and Dr. Bramwell just to make sure that we stay informed.
President Wagers.
Trustee Oppenheimer.
Thank you. Deputy Superintendent Roberts, could you go back to the quarantine? I think I misunderstood that. If a student, did you say, just clarify, did you say that if a student wearing a mask is exposed but does not have symptoms, they will not need to quarantine? Did I hear that correctly? Could you repeat that, please?
President Wagers, Trustee Oppenheimer, yes. So if you have 2 students and they're both in masks, and this student winds up with testing positive for COVID, but they had on their mask the whole time that they were interacting at school with this student with a mask on, as long as that student with that was also wearing a mask doesn't have any symptoms, they will not have to quarantine.
Follow up, please.
Trustee Oppenheimer.
Thank you. So if that student does have symptoms, how long would that quarantine be?
We've got the decision trees that we'll be following closely, but there are different factors that can affect that. So they, they could get a test at 3 days, 5 days. that right? Tamara Frederickson, our health services supervisor. So there's different ways that they can test to be able to come back to school sooner than the 10 to 14, quarantine days we were looking at last year.
Okay, thank you.
Deputy Superintendent Roberts, can we explore this maybe a little bit more on the quarantining piece? Because I think it's a key factor for me that I'm looking at, trying to understand. So let's say you have a classroom that has somebody test positive for COVID. And doesn't matter if it's a student or a teacher. Previously, if they are masked, just that person is going to have to quarantine if everybody in the classroom is masked. Is that correct?
President Wagers, a letter will be sent home like we've done in the past. We'll ask other, students to monitor their symptoms. And if there are no symptoms, they can come to school with their mask on.
What would happen if people aren't masked? Explain that situation to me.
So President Wagers, what would happen is any student that they were within 6 feet of, they would all have to quarantine, which in an elementary classroom, a lot of times what we'll do is pod those students. So you might have a student with 3 other students. All 4 students would be quarantined. Or the really difficult thing is secondary, where you have them sitting in one class with maybe 4 kids around them. Then they go the next period with 4 kids around them. All of those kids in every period would have to quarantine if we weren't wearing the masks.
Would it be different if somebody was vaccinated? Like, I know that can't happen in elementary because there's no elementary kids that are vaccinated, but let's say it's secondary. If someone had we would maybe do we at that point ask for vaccination proof?
President Wagers, we will not ask for vaccination proof unless they want to show us the vaccination proof. But if there's somebody has been vaccinated, then they also would not have to quarantine. They are asking, however, that adults, that being vaccinated for adults, that if that they would also like them to wear a mask specifically because this new variant is so contagious. So that's why they're recommending that masks be worn in addition to vaccination. They're seeing a lot of breakthrough cases, unfortunately, with folks who have been vaccinated. However, their symptoms are much more mild, but they are seeing some breakthrough cases. So that's why that extra layer of protection.
So I'm probably expanding. So the recommendation you're coming up with seems to be, it's hard to imagine the quarantining, how amount of time we're going to have to spend on quarantining students if we don't have masks. I mean, can you expound on that? How much time?
President Wagers,
What that
that
would
is
be like?
actually our number one reason for wanting to go with the masks, is because it's really difficult for students to quarantine and be out of class, for teachers to try and keep track of in class with the students that are out of class, or even just to try and keep enough staff with substitutes in our buildings. We've got students who are really excited this year to be in school in person all year, who want to participate in sports and don't want to have to sit games out because of the quarantine. We feel like the masks at this point in time with this high transmission are our absolute best bet to starting the school year in person 5 days a week.
Thank you. Other trustees?
President Wagers?
Trustee Hawes.
So to clarify, I think, so if the community spread goes down, then you would consider at some point whether or not to continue masks as a mitigation strategy. Is that correct?
President Wagers, Trustee Hawes, absolutely. And what we would look at is all those different factors too. We'd look at how many, what we're hearing from Central District Health on the percentage of students who are vaccinated, on the availability of the vaccination for our 5 to 12-year-olds. We've offered mobile vaccine clinics at our junior highs and high schools. We would definitely be open to offering those again if that would help. But we'll look at all those factors again, and of course, talk to our local doctors as well as CDH. But we are, when we approved this plan, July 12th, we really thought that it would be optional or, encouraged if you weren't vaccinated, for sure, if you weren't vaccinated, to wear a mask. But we were to wait a much different spot then as far as transmission in the community.
President Wagers,
Trustee Langley.
can you tell me if it makes a difference if there's a line in the sand where we have vaccination rates that we would then unmask at that time?
President Wagers, Trustee Langley, I would need to consult definitely with Central District Health and the local health professionals to ask them what their opinion would be on that percentage. But I will tell you, everything we're hearing is the more we can get vaccinated, the better our chances are at not having to wear face coverings and to be able to have in-person learning. Our biggest fear is to have to go back to remote learning. We do not want to do that again.
And kind of as a follow-up to that, the vaccination rates for some age bands. I saw an article on it, but I'm not sure it's correct. I want to know. So like a 12 to 15-year-old, I saw one, and the 16 to 17-year-old, I saw some vax rates where we currently are in those areas.
President Wagers, we had those for the state of Idaho, and I don't believe I have them right in front of me.
Well, I wrote them down from an article today.
Okay, good.
And I'm not sure that's the same numbers, but I think it came from the Idaho Health and Welfare. So 12 to 15-year-olds, I think we're 22% have one dose, and 16 to 17-year-olds, 31% have one dose.
President Wagers, that sounds correct.
So, and I look at that and maybe I'm not supposed to be talking yet, but when I look at that, the problem is it's back to that quarantining issue. So so let's say we go into a junior high classroom, we have a case of COVID, 22% only are vaccinated that are going to be able to get out of that quarantining. The other 78% are going to have to quarantine. So that decimates a classroom.
President Wagers, it does. And you have to remember too, that we are not starting the school year remote this year. We're not starting the school year in hybrid, where all those systems have been set up that helped. It didn't make it easier, but that helped do at-home learning as well as in-person learning. We do still have the option of our Boise Online School. We will enroll students if parents choose to do that at any time, and we will staff that accordingly. Right now, we are, just in case you're curious, we're at 150, I believe, secondary students, yes, for our Boise Online School, and 100 secondary students for Boise Online School. 100 secondary, 100 elementary, sorry,
Okay. So
Follow up to that.
250.
Trustee Langley?
Follow up to what you said, President Wagers. I'd just like to add that Ada County, as of yesterday, when I looked at our vaccination rates for adults, was 60% vaccinated. So I think that that's also, it is our obligation to protect the children, but our entire constituency is in the mix here with this new variant and what our children bring home from school. So those are a bit disappointing of vaccination rates, even in adults, in my perspective.
President Wagers.
Trustee Oppenheimer?
Deputy Superintendent Roberts, what will the classroom look like this fall when students start? Will you continue to have the social distancing to the best of your ability, or is it going to go back to what it was, 2 years ago?
So President Wagers, Trustee Oppenheimer, it's a great question. We're hoping in the middle. So we're hoping it's not going to look as extreme as last year. We're definitely not going to be back to where we were at the beginning of the 2019 school year, but we are hoping that we won't be nearly as strict and stringent about the distancing, that we think because of the masks, truly because of the masks, we can have a small reading group come together and work together. That's what we're hearing about, especially when it comes to the quarantine, that we can have our back to school nights if that's what they want to do. There's lots of things that we will actually change because of the last year. So for example, I could see as for conferences at the elementary, offering online if that works for a family, or offering in person if they'd prefer that. So there's some things that we will just naturally change because it's worked out better for families. But I don't think you're going to see things as probably rigid as they were last year, but we're not quite back to 2019 procedures other than masks and hand sanitizing.
Follow up, please.
Go ahead, Trustee Oppenheimer.
Thank you. And the recommendation that you all have put forward, how does that impact extracurricular activities, including sports?
So President Wagers, Trustee Oppenheimer, I have to say, I was very skeptical last year of being able to successfully do our sports program with masks and with all the different social distancing we were trying, and we were very successful. So it will look much the same this year as far as athletics goes, as it did in the spring, for example. And I think we'll be pretty successful with that. We proved that we did not have, we had very limited, I should say, transmission in our athletic programs. And so we'll continue with those same types of mitigation factors for this year. but hoping we get to have full seasons all year long. That's another good reason for masks.
President Wagers,
Trustee Langley.
Deputy Superintendent, I'm curious how the staff has reacted to, or have you been able to talk with the staff about masking? I know that we have a lot of parent feedback, but I'd love to hear your feedback from staff.
President Wagers, Trustee Langley, I did, of course, reach out to the BEA and talked about it. And I'll be honest, I think we have a lot of teachers that are really angry that they have to wear a mask again. Not that they argue having to wear a mask again. They're just disappointed that we aren't at a point where they can teach without a mask. So from what I'm hearing, they understand, they get it. They understand why they're going to need to put a mask on again for their own safety, for the safety of their family, and for the safety of their students this year. But they obviously would rather not wear a mask. I can tell you, I would rather not wear a mask. But they're willing to do it. And that's the letters that we have received to the board. The information that we've gotten up here have been from teachers saying, don't want to do it, but I get it.
Thank you. President Wagers,
Trustee Langley.
Deputy Superintendent, just checking in what our plan is for volunteers in the school next year with masking.
President Wagers, Trustee Langley, we will allow volunteers and visitors as long as they are masked.
Thank you.
Any other questions from trustees on the recommendation from the administration?
President Wagers.
Trustee Gregory.
So Deputy Superintendent Roberts, I assume that we're following the protocol that we established last year where our decision goes out to principals. Principals customize it to their buildings. We also have operations in place for busing, for food service, et cetera, and so forth, covering all operations of the district. And those will be developed by those department heads, et cetera. Can you comment on that?
President Wagers, Trustee Gregory, thank you. Absolutely. And as a matter of fact, right now, a lot of those have been done and a lot of them are just about finished up. So I know like athletics, they worked on finishing that up today. I know that, for example, our music programs, he's finishing up working on those today. And then our schools, some of our principals have just come last week, but they're all working on their school plans. And truly, that was one thing that we'd all talked about was they pretty much knew what they were going to be doing. So the addition of the mask, that won't be a heavy lift for our administrators to put into place.
President Wagers, is a motion in order?
It would be time for a motion if a trustee chooses to make a motion.
President Wagers?
Trustee Gregory.
I move that we approve the plan brought forward by the administration to require masks for all students and staff and follow the protocols developed by the building principals and operations departments.
I'll second.
So it's been moved by Trustee Gregory, seconded by Trustee Oppenheimer. Basically, the administration requires, and I'll paraphrase from the recommendation, face coverings indoors for all students, staff, and visitors, regardless of vaccination status. Now we are open for discussion between trustees on this motion. Trustee Greeley.
I'm sad that we're at this place too, right now, as I think it was Trustee Langley was talking about. But my narrative is simple. Students receiving a high-quality education in the classroom 5 days a week in front of their teachers, amongst their peers, is best for students. Considering the increase in the positivity rates that you discussed, community transmission since our July 12th board meeting, and the current advice of our medical consultants, a mask mandate is the best way to ensure student safety, as well as staff safety, and allow our students to receive a high-quality education in person in the classroom. I will be supporting it.
Any other
Representative
discussion from
Winters?
trustees? Trustee Hawes?
We've I've heard this a lot over the last few months, is there's really no playbook for this, for dealing with COVID. So I think what we need to do is really look at the strategic plan. And so I went back and looked at the strategic plan, and it does talk about school environment and safety. And it is our goal to provide safe, respectful, and supportive school environments for students, staff, volunteers, and patrons. And strategy 6 says, provide an appropriate and safe learning environment for students and staff. And the key word, I think, there is appropriate. Given the community resources, it's not possible to provide 100% safety in the school's environment. So what is appropriate? And I think in my mind, what you have to look at, what is appropriate is you have to weigh in stakeholder input. You have to look at the guidance from the administration. You have to look at CDC guidelines. And I think you also have to look at whether or not the plan provides flexibility. I think we have that here. And that's why I voted for the plan in July, because of the flexibility component. That goes into what I feel is great about this as far as whether or not this is appropriate. I think it's an appropriate plan. I like the plan because it provides the district with flexibility to use additional mitigation measures in dealing with COVID, or to reconsider existing mitigation measures. So I really, so that was one of the reasons I voted for the plan. I do want to recognize the community's input on either side, and whatever view of whatever plan that we were considering. If this community had nothing to say about the plan, then we would all be in trouble. So I want to acknowledge the community in that regard. And I want to acknowledge those who object to students wearing masks. I want to acknowledge that. But in my mind, with the backdrop of COVID, we have to focus on, quite simply, what gives the students the best opportunity to participate in in-class learning. And in my mind, this recommendation, along with our original plan, gives us the best opportunity to do that. So because of this, I believe our plan and our updated recommendation provides, again, these best opportunities for in-class learning. And for this reason, I support the district's recommendation in its entirety.
Thank you, Trustee Hawes. Any other trustees?
President Wagers.
Trustee Oppenheimer.
Thank you. I'd like to echo my fellow trustees in the support of this plan, and recognize that none of us want to be having this meeting tonight. None of us want to be making these decisions today. I also want to thank the students and the families for sharing their thoughts and concerns. We just finished up with a year and a half, I guess, of kids not in school, and the impact that had on our students, not only learning loss, but also on their mental health and well-being, and the increase that we have seen, and I have personally seen an increase in students in severe depression, anxiety, by not being in school with their classmates and their teachers. It's devastating and it's hard. And no one wants to wear a mask, right? I get it. But at the same time, I want our students not only to be able to be fulfilled with their learning abilities, but also with their social and emotional well-being. And kids need to be in school, and they need to be surrounded by their fellow students, and they need to be in person with their teachers. And if we have to wear a mask in order to be in school, and I think that is our goal this year, then that's what we need to do. And hopefully we can get to a place where we can remove the mask someday. Hopefully our vaccination rates will go up, and these cases will slow down. We don't know, just like we were a year ago. We don't have a crystal ball. We didn't know 2 weeks that we were going to be sitting here tonight. But again, it really is about our students and our teachers and social and emotional well-being, learning loss, and in addition to that, our families' ability to work. And we know that when our students were at home, families had a very difficult time being able to work outside of the home. So if we can do this simple task and wear masks, I fully support it, because at the end of the day, we want our kids in school.
President Wagers.
Trustee Gregory.
I have one question, if I could direct it to Deputy Superintendent Roberts. I'm wondering about school functions, and will there be a limit on people gathering? And how will those kind of decisions be made as we go into a new school year?
President Wagers, Trustee Gregory, at this point, we are not putting limits on gathering. Each school will determine what type of a gathering they want to have. Of course, we're encouraging as much social distancing as possible, but every school will determine how they want to do that. So they may do a back to school night that's staggered, like maybe first grade arrives at a certain time, second grade the other time. But we will not limit right now the amount that can gather.
Follow up. So that again refers to that kind of individualized school plan. And they'll also be guided by their athletic departments in terms of how social distancing works in spectator arenas, et cetera.
President Wagers, Trustee Gregory, yes. And like I said, that we don't have all of that rolled out yet to our schools, but we will get that out in the next week.
Follow up, President Wagers, follow up.
Sure.
Well, not a follow up, but I just want to make a comment. Thank you, Deputy Superintendent Roberts. I agree with my fellow trustees that 2 weeks ago we did not want to get here, and you know, the globe is really enmeshed in this pandemic in a way that continues to alarm us in its waves and its impact on families and economies and countries at every level. And I will be supporting this motion because I feel like it is our best chance to keep kids in school. And keeping kids in school has that ripple effect that has been addressed by the other trustees. And that's what I feel is a responsible thing to do, to help our kids begin and continue through a stable year in school. With the efforts that we've made over the summer to address learning loss and prepare our staff to just go great guns at it. You know, best case scenario, we would see a decline in all of our numbers and be able to unmask sooner than later. But at this point, I think for the safety of all, I'm supporting this motion. Thank you.
Thank you, Trustee Gregory.
President Wagers.
Trustee Langley.
I just wanted to echo my fellow trustees and also give a shout out and an acknowledgement to the teachers who have been so flexible and the parents who have been so flexible through this time. I understand their frustration and I'm frustrated. It's hard not to be angry when we think about all of the changes. Just 2 weeks ago, when we voted for the policy that would give each family the flexibility of choice, there were choices available to each family to vaccinate, to be masked, to make choices like what they felt was best for their family. But the Delta variant was not aggressively being involved in our community decisions. So that's a big change. Additionally, the low vaccination rates, I find that to be pretty upsetting to me, and not only in our children that have the availability, but in adults in our community. So I encourage all of our constituency to take the opportunity to learn about something I'm very proud our district is doing, which is providing clinics for vaccination. as well as partnership with many other organizations that are providing vaccines. So if you have the opportunity, you're healthy enough to do it, I just encourage people to take an opportunity to protect their family in that way. Additionally, I'm absolutely supportive of this initiative to mask because, like we've already addressed and committed ourselves to for the coming year, we need our children to be able to be in school together so that we can put in motion the new strategic plan additions that we have added of considering their mental health, having them together, addressing their curriculum loss. And we have spent this entire summer with our staff, our administration, and so many people are involved in caring for these children to create a future for them in this coming school year that really addresses the last year and a half of loss and suffering that these children have had to face. And that's a global effect that all children everywhere have had to face. But our children have a plan in place because of the Boise Public Schools. And to have the opportunity to put that plan into action is so vital. And so it's unfortunate that it had to change in a 2-week span because we didn't see this Delta variant coming. And we don't have the protections in place in our community yet to deal with it. And that's going to be the facts. If we don't get community protections in place, every variant is going to throw us for a loop. So while we protect our children with masks, and I'm very excited to be able to put into place and into action the education that our district has planned for this coming year.
Thank you, Trustee Langley. I guess for me, it's just very simple. It's what's best for kids. It comes down to that. And I look at the quarantine policy that we need to follow, and we can't keep kids in the classroom if we have to quarantine based on our vaccination rates and no vaccines in K through 6 at all. So it's not a doable way for us to do school. And it's too important to me to have kids in the classroom in front of teachers who that's the best way they learn. And we got to make that available. So I will be supporting the motion as well. Any other comments from trustees?
President Wagers, I have one comment.
Trustee Gregory.
I think as was our practice in this past year and a half, our staff, our counselors, our nurses, our principals are always there to work with families who have students who are experiencing a high level of challenge or anxiety, et cetera. And so I would encourage parents and any student, parents being the advocates. But as we get 7 through 12, our students can advocate for themselves in many circumstances to talk with their teachers, to talk with their counselors and their principals. If they have, special circumstances that arise that need to be addressed with some extra services. There are caring people in every building and in every classroom who stand ready to support students through this difficult time and support families through difficult times. And we can do this together. And as a school community, we can meet that goal of keeping kids in classrooms.
Thank you, Trustee Gregory. Any other trustee comments? Administration comments? Hearing none, we'll go ahead and take a vote on the motion. Once again, the motion following the recommendation of the administration is we will require face coverings indoors on all student, staff, and visitors regardless of vaccination status. We'll need to do a roll call vote on that.
Trustee Greeley? Trustee Gregory?
Aye.
Trustee Hawes?
Aye.
Trustee Langley?
Aye.
Trustee Oppenheimer?
Aye.
Trustee Wagers?
Aye.
Motion passes.
So we have, we'll move on to board superintendent comments. Are there any board superintendent comments? Okay, hearing no board superintendent comments, I would entertain a motion.
I motion to adjourn.
There's been a motion from trustee Greeley to adjourn. Is there a second?
Second?
So-
Second from trustee Hawes. All in favor of adjournment?
Aye.
Aye. Any opposed? Motion passed.